Today, we're pulling back the curtain to get inside the real, unfiltered discussions that physicians are having about anemia all around the world. This isn't about what's said in polished presentations at conferences. This is about the gritty, everyday challenges they're facing with their patients.
So let's get right to it. What are physicians really talking about when it's just them and their peers? You know, not in a published paper, but in the private, trusted digital spaces where they go for real advice. That's exactly what we're about to uncover.
And you might be asking, how do we know all this? Well, these insights are sourced directly from GMAT. It's the world's largest online community of triple-verified physicians. So this isn't survey data with canned answers. This is a direct look into real, raw, peer-to-peer clinical conversations. It's the real deal.
And the scale here is just massive. We're talking about insights drawn from a community reaching more than 28,000 physicians across 84 different countries. So this isn't just a small snapshot. It's a truly robust global picture of the conversation.
All right, with that foundation set, let's dive into what we found. First up, what are the biggest hot-button issues? When it comes to anemia, where is the conversation actually happening?
And here is where it gets really interesting. Just look at this breakdown of the top discussion topics. At 15%, iron supplementation strategies is number 1. But look how close transfusion thresholds is, right behind it at 14%. They're practically neck and neck. And then you've got anemia and oncology rounding out the top 3. This tells you that practical, high-stakes decisions are what really dominate the chatter.
So yeah, iron supplementation, it is hands down the single biggest topic of conversation. It's clearly where physicians are spending a huge amount of their time asking questions, venting frustrations, and looking for better answers from their colleagues.
But here's the thing. That leads to a really critical question. If it's the most discussed topic, you'd think it's a solved problem, right? Are the strategies we have right now actually working for doctors and, more importantly, for their patients? Well, based on these conversations, the answer is a huge no. A staggering 76% of physicians reported major issues with iron supplements. We're talking about things like gastrointestinal intolerance that makes patients feel awful, poor adherence, meaning people just stop taking them, and delayed responses that leave doctors guessing if the treatment is even working.
And believe me, this frustration doesn't just stop with iron supplements. It's a theme across the board. In oncology, you see 78% of doctors are cautious because of complications or cost. For kids, a massive 83% worry about missing subtle symptoms. And for vitamin deficiency anemia, 71% are flagging how often it gets misdiagnosed. The pattern here is crystal clear. There are a lot of unmet needs.
So now, let's shift gears a bit and walk through the patient journey from the doctor's perspective. We can break down all this conversation into the 3 big stages: diagnosis, treatment, and follow-up.
Wow, this chart right here says so much. I mean, look where the vast majority of the conversation is happening. 29%, almost a third of all discussions, are centered on diagnosis. That completely dwarfs treatment and follow-up. So what does that tell you? It tells you that getting it right from the very beginning is a huge focus, and very likely a huge pain point.
So even though doctors trust the standard lab tests, the conversation showed that the real trouble starts when things get complicated. There's a ton of confusion when different types of anemia overlap, like when a patient has both iron deficiency and anemia from a chronic disease. It's like trying to solve a puzzle when the pieces from 2 different boxes are all mixed together.
Now, when we get to the treatment phase, the central debate that pops up again and again is clear. It's oral versus IV iron. The chatter shows that oral iron is still the standard first-line play. But physicians switch to IV iron when they absolutely need a faster response, especially if the patient can't tolerate the oral pills or has absorption issues. The thing is, even IV iron comes with its own set of problems that doctors frequently bring up, like high costs and issues with access. And that brings us to follow-up, which, honestly, might be the biggest hurdle of them all. This statistic just says everything. Nearly 3/4 of physicians, 73%, talk about major barriers in the follow-up stage. And the number 1 culprit? Patient non-adherence. You can get the diagnosis perfect, have the best treatment plan in the world, but if the patient doesn't stick with it, the whole thing just falls apart.
Okay, now we get to what I think is one of the most fascinating parts of this whole analysis. We're going to zoom out and look at how a doctor's location on the map can completely change how they manage anemia.
The data is just crystal clear on this point. Anemia management is absolutely not a monolith. Where a doctor practices changes everything. You could have 2 identical patients, same labs, same history, but if one is in the United States
and the other is in the United Kingdom, they are likely going to get two fundamentally different treatment plans.
And it really boils down to two competing philosophies. First, you've got the aggressive treatment camp, which is common in places like the US and Brazil. Here the focus is all about rapid correction, often using transfusions or other interventions to get those numbers up fast. On the flip side, you have the conservative treatment philosophy, which you see a lot in the UK and Spain. Their approach is to prioritize iron repletion first, and they follow much stricter rules about when to transfuse.
And this table just lays out that global landscape perfectly. You can literally see the countries clustering together. The US, Brazil, and Canada fall squarely under aggressive treatment. Meanwhile, Spain, the UK, and Italy are firmly in the conservative camp. But it's not just about the first move. Look at follow-up. Germany, the US, and the UK tend to have more structured approaches. But in places like Turkey, Australia, and France, you see physicians talking a lot more about unstructured follow-up and patients getting lost in the system. Geography really does shape the entire philosophy of care.
Okay, so we've seen the frustrations, we've walked through the patient journey, and we've seen the huge global differences. Let's bring it all home. What are the real engagement opportunities here? How do you turn all this insight into meaningful action? Let's make this personal. As someone who's trying to reach and support these clinicians, what do you do with all this? How can you get this inside look at a physician's world and use it to build something that's actually effective and, actually resonates with them? From what we're seeing, it really boils down to four massive opportunities. First, address those knowledge gaps in complex cases. Second, give them support with those tricky diagnostic challenges, especially the mixed anemia types. Third, and this is huge, tailor your message by region. A one-size-fits-all approach is doomed to fail. A message built for a doctor in Boston simply won't work for a doctor in Bristol. And finally, number 4, help them solve the follow-up problem. If you can provide resources to tackle patient non-adherence, you're not just a company, you're a true partner.
So I'll just leave you with this one final thought. After seeing the real-world frustrations, the debates, and the challenges happening between physicians every single day, the question you have to ask is, are my current strategies truly addressing their reality? Because this data, it's basically a map that shows you exactly how to make sure they do.